Okay, welcome everyone. My name is Michael Wilson. I'm a fire solution architect at CSIRO on the Spark program. So I'm going to take you through today. This is our kickoff call for the Spark testing event. That is 2 weeks from today in Brisbane. So this is a sort of open meeting. I've got a whole heap of stuff to go through, but open to questions. Just raise your hand throughout the meeting if you've got any questions. I'm happy to answer them as we go. So it's as much about getting you prepared for the event. So yeah, any and all questions are welcome as we work through this. And I'll move on to find my right screen to an acknowledgement of country. So we acknowledge the traditional custodians of the land on which we all gather today. We pay our respects to our elders past and present and extend our respect to all Aboriginal and Torres Strait Islander people, acknowledging the First Peoples as the first scientists, educators and healers. So the agenda for today, these are all the things looking to go through. We're just going to do a quick intro, give you an overview of the event, talk about the fire implementation guides that we're looking to test at this event, connected test scenarios. That's probably where we'll spend most of our time looking at those. Talk about some testing tools that we have available for you to use, providing feedback and test results, and prepping for the event. And there's an opportunity to ask questions at the end, but like I said, if you want to ask questions as we go, happy for that, just raise your hand. Hopefully someone will keep an eye on that for me if I miss it, and pay attention to the chat. So just to give you an idea of some of the facilitators we're going to have, we've got a full Spark team that will be backing this event. Oh, Danielle, you got your hand up already?
I did. I thought I would model out your suggestion and just say we're going to be putting the recording of this out on YouTube under the HL7 AU correspondence for like AU core or like testing. Is that still the plan?
Yes.
Awesome. Sounds great. Thank you.
That's good. Shows the hands work. So yeah, there's going to be a full group of Spark people attending this event. There's going to be a whole heap of us with Spark shirts on, and some others helping out as well. So we've got plenty of support here. Here's just some faces and names. You may have seen a number of us before, but you can reach out to any of us to get support on the day or before the day as well. As far as details for the event, there's only 2 links you actually need, and that would be this one, the event information page. Everything you need will be gone through here is somewhere on that information page, or the information there. Like Danielle said, we're going to put the recording from this up there. The slides are up there already. So you can go back to that and look at any time. The other one is the event chat, which is on chat.fire.org. We'll just jump across to those and I will put them in the chat. Get to my screen. So this is the event information page. I'm going to put that in the chat. And so here we've got a description of the IGs, and actually if you go to the parent page, the one above this one, this is actually where the slides are available, and we'll put the recording in here as well, and that has the agenda for the day. But the sub pages underneath that, the primary one is the testing information page, which has information, all the information you need about the IGs that we're testing. We also have the participant system details page. So this is something that we want you to fill out with the systems that you're bringing so others can connect. And then we also have the test scenarios page, which we're going to go through with that as well. The other important link that we've got is the one to, we get back to it, is chat.fire.org. So if you don't have an account for this, I definitely recommend signing up to one. We do have a channel that is here dedicated to this event. So if you've got any questions or the like, you can post them there. And this can be used for communicating with other people at the event, saying I've got something if someone wants to test this, or it can be contacting us to ask for help to prep for the event or during the event. So use that for anything to ask questions or provide updates and connect with others. So they're the two key links. If you've got the primary link, if you've got the link to the information page, all the other links are off that page. So that's the key one. If you're going to get any, make sure you've got that event information page. Now, an overview of the event. So what are we looking to do here? So really what we're providing here is a hands-on environment for testing your file-enabled products. So essentially, we're providing a space and a place for you to come together to test your system with others. So we're really looking for that collaboration amongst other implementers. This is a safe place. It's a safe place to fail. It's a great place to talk to others about how they're doing things, what sort of issues they're having, what they're trying to do. So it's a safe place for us to come and look to collaborate between us with your fire systems. And with that, we're looking at testing IGs, including AU Core, AU e-requesting, the Health Connect provider directory, AU patient summary, and smart form fire implementation guides. We're looking at bringing all those to one place where we can test together. So we'll be looking at working through connected test scenarios that exercise interactions across multiple IGs. So what we've done in the past at these test events and connectathons and like, we've normally been quite siloed where we go, you know, I'm testing AU Core, or I'm testing patient summary, or I'm testing smart forms. What we're trying to do here is I think we've matured as a community where we're now looking for sort of more complex scenarios and that to work through. So we're looking at providing that opportunity here where we can try to cross the streams of some of these IGs and look to sort of push the boundaries of what we've been testing in the past. So as part of that, be working collaboratively with others, implementers to test and showcase what you can do. So we want to see what you can do, what you can come up with, what you can try and do on the day. And then providing that feedback as well, sharing your insights. How can we refine the IGs? Where do we need to go next? What do we need to do with those? And so the goals really we're looking at, we want to demonstrate interoperability across systems in those connected test scenarios, and then gather that essential feedback to enhance and mature the IGs. So as I mentioned before, Sparked, we love Mentees. So if you can grab your phone out and scan that QR code, or just go to menti.com and enter the code 89733669. Hopefully that's the right one this time because it just changed on me. But we have a Menti, and you can scan the QR code on the right hand side of this as well. Looking at how many of you have been to testing events before, how many of you new, just to get a feel for where you're at. It's quite good. We've got quite a good mix looking there from old hands that have been to these before and newbies as well, so, which is great. A couple have been to other. I'd be interested in on what other testing events you might have been to that haven't been one of the HL7 or Sparked ones. You can put in the chat if you're too shy. Okay, we got pretty well close there, but I think it's a good mix. So there'll be others that have been to these before that you can reach out to and help with if it is your first time, and there'll be plenty of Spark people here as well. So we'd like to have, oh, there we go, Michael Osborne, Queensland Health Connectathon. Yeah, didn't think of that one. And Dev Days, another non-HL7 fire training testing. Okay, that's good. I'm going to jump to the next one on here. And so this is just, what do you want out of it? So we're going to tell you what we're looking at doing, but what's your interest? What do you want out of the event? So the QR code in case you're late. Come on. QR code. Catch up. Validating our build, increase the knowledge. Yep. New stuff. Yep, saying a theme there around new ideas, new stuff. See. No one said they're coming for the food. It's normally pretty good. Oh, food, there we go. Check out the Health Connect provider directory. There you go. Beers. Yep. Demo some interop workflows. Okay. That looks pretty good. All sorts of stuff we'd like to see. We've had good open community for us to share ideas and new ideas, which I think is a good theme there. Well, we've got plenty more to get through, so I might just move on. I'll leave that open. If you want to put anything else in there, you can continue in that Menti if you like. But I'm going to jump back to on. So 8th of July is the day. So 2 weeks today, and we'll be at the Ridges Fortitude Valley. So you'll see the agenda here doesn't look too exciting, but that's because it's not a talk fest. We actually want to do some real testing. We want to get hands dirty, getting systems connecting to each other and showcasing interoperability. So we'll just start with a quick sort of welcome and intro. So basically registration's open at 8:30. So from 8:30, we'll be there. You can come sign on, grab a coffee, get yourself settled. Then from 9 o'clock, we're going to kick things off. So we'll do a relatively short intro here, go through some of the things we've gone through here today as well, make sure we're all set up and ready to go. And then apart from our breaks, we're pretty much testing. So this is our opportunity to heads down, tapping keyboards, trying to get systems to talk to each other. So that'll be the focus for the morning, right through to lunch and then the afternoon. What we'd like to do in that afternoon session, after the afternoon tea, is looking at sort of really collecting some results about what we've done and provide an opportunity to sort of showcase any of the sort of exciting things that we might have achieved during the day. So a bit of a sort of making sure we collect the results and a report back show some others what we might have done. And then at the end, at 5 o'clock, we'll sort of close out and a bit of networking if we want to go for beers or something afterwards. So yeah, there's no, like I said, there's no not talk fest. We're not going to do presentations and the like. So it really is just hands-on connecting. So the fire implementation guides. So these are the ones that we're looking to test throughout the event. So we're looking at doing connected test scenarios with these 5 IGs: AU Core, e-requesting, the provider directory, patient summary, and smart forms. So I'm just going to do a very quick run through of each of those IGs. There is more details on these on the information page for the event. So just very high level summary. What we also have for each of these, it's like we move to AU Core here, we're going to have a primary contact for this. So if you've got questions at the event, prior to the event, to know more about this, you can reach out to that. There'll be plenty of others there that know about it and you can talk to as well. But if you're looking for who should I talk to, you can start with the primary contact, which in this case, AU Core will be myself. So AU Core, and what AU Core is, it sort of sets the minimum expectations for a system to record, update, search, and retrieve core digital health and administrative information. So as we know, sort of AU Core is the sort of foundation IG. It doesn't have any specific use cases, so it is more generic. And some of the things we're looking to test at this event in AU Core space is there's a number of new profiles that will be hot off the press. They will have just squeezed in prior to the event, and they'll include things like diagnostic report, composition, document reference, endpoint, and medication dispense. So there'll be some new things we're looking at testing for AU Core, as well as just any testing of our existing profiles, elements, interactions, and the like. And the key things we'll have to support AU Core here as far as resources, we'll have a sparked AU Core Fire server. So there will be a read-only Fire server available from Sparked which will be loaded with test data. We also have a heap of test data in the HL7 Australia test data repository that is being built for AU Core, and we have an AU Core Inferno test kit as well. So if you're wanting to use any of those, they're key resources for testing AU Core. E-requesting, primary contact for e-requesting will be Michael Osborne. It sort of sets the minimum expectations for placing and accessing electronic requests. So release 1 of e-requesting went out earlier in the year, and it focuses on pathology and medical imaging requests and community-based care. And its primary focus of testing is the new bundle profiles. There's a branch for that. I don't think it's in the CI build yet, but there's a branch for that. And then imaging request bundle, pathology request bundle. There is a sparked e-requesting file server as well that will be available at the event, HL7 Australia test data, and a postman collection of examples there. I don't know, Michael, did you have anything else you wanted to add to e-requesting testing? Mute if you're talking.
I have to get the right mute. Only if people are testing e-requesting, let me know, because all of our artifacts are currently at FMM1, and we probably need to start to look at getting them to FMM2. Even though some of the major players won't be there, you might be able to help us out there. Yep, that's about it.
Okay. All right, we have the Health Connect provider directory as well. Ricardo will be the primary contact for that. So this is their first initiative under the Health Connect Australia, and it'll enable providers to discover accurate, up-to-date information about other providers and the services they offer. Testing focus there is on searching for healthcare services in a location, searching for practitioners to send a referral to, or taking a bulk export of the national system to populate a local directory. And they have the IG that's been published by the Digital Health Agency, and they'll be bringing a test server as well, which is loaded with the directory. Ricardo, anything else you want to add around your objectives there for the provider directory?
I think you've covered it well. Probably the only thing I would add is that we're in the coming days, we might just drop a Spark testing event version that's specific to this IG to be used on the day, because we're adding a few more tweaks to the bulk export functionality, but that will be minor stuff.
Yep. Okay, that's good. I think using the chat.fire.org will be good too. So sort of if you keep an eye on that, as things are available for the event, people can put in there, and
we'll
when the systems are available.
Yep.
Good. We have a patient summary. Danielle will be the primary contact for this IG. So it supports patient summaries in Australian context, complying with International Patient Summary and AU Core. And the primary testing focus here is on producing, exchanging, consuming, and viewing Australian patient summary documents and consuming an IPS. We have a sparked AU patient summary file server available as well, which will have the dollar summary capability for getting a patient summary, and will be loaded with the IG examples. There is also the IPS reference server and viewer, and the AUPS Inferno test kit that will be available if you're interested in testing with that as well. Danielle, anything else on patient summary?
Yeah, a couple of items. I think Orion Health has indicated, though they can't come to the meeting, they would be also to this test event. They would be happy to make available an endpoint for that. I think we need to follow up what that would look like. So that's possible.
I'm here.
Sorry?
Oh, this is Eliza from Orion Health. So if
Oh,
there's
Lisa,
anything.
hi. Yeah.
Hi. I know I've missed a few meetings in other respects, but yeah, I'm here, and yeah.
So does that mean that you're okay? So are you guys going to be like in person at the call?
No.
Or like in the meeting? No? Okay.
It will be remote, so we will not be physically there. We can attend whatever we need to attend if there's a virtual digital option of it, and I will put in our connectivity information on that Confluence page that's shared so that people can call our dollar summary, our doc ref. We'll put, we can share a piece of some sort of documentation if they want to try pushing an IPS to us, if they want to try calling some stuff. So basically all the functionality that we had available for the Rotterdam stuff.
All right, that sounds fantastic. If you guys are happy to manage, because I know the time zone is pretty good, to manage that just via like Zulip and have people direct contact you. Otherwise, if you think that we need to like word up me on the ground, then I'm happy to jump into a chat and see what I can do. But you guys are probably fine.
Yeah. I'll make sure I have Zoom open. I haven't logged in for some time, and I noticed I ignored Heath for a week. But I'll have it up and open, and I'll get someone else in my team as well. So we've got 2 people listening for dings. Thanks, Heath.
Awesome. Heath is also going, yeah, I can assist. Brilliant. Okay, that sounds great. Thanks, Eliza.
Awesome. No, well, thank you for letting us do it remotely.
No worries. The other thing I wanted to talk about is the intention for this testing event is that we would have like the official UPS 100 publication. That is in discussion with international. There is an international publication that came out, which is a technical errata, and Dushi found some errors. So as of this morning, there's a bit of a movement in international on what we do around that. So we will have a snapshot available for this testing event, and I really hope it's like 100 of AU patient summary. But there's still a little bit of convo going on with international to make sure that all of that lines up. And yeah, anyway, that's all I wanted to say.
Thanks, Dan. I'm moving on to smart forms. So smart forms is an ecosystem for standardized clinical forms underpinned by FHIR questionnaire, questionnaire response, structured data capture, and smart app launch. So Liam will be the primary contact for that. Liam's on leave at the moment, so he's not here today, but he will be there at the event to look after this. So the focus for this is looking at smart app launch, standard smart app launch, as well as with questionnaire FHIR context, smart health checks, launch, so pre-population, write back and retrieval, and the GP chronic condition management plan with launch, pre-population, write back and retrieval. So resources that will be available for this: CSIRO smart forms app and a playground, and pre-population form servers, and the smart app launch test kit, and the smart health checks Inferno test kit. So that will be there. I don't know if I know Liam's not here. Was there anyone else from Liam's team here today that might be able to talk any more to that?
Yeah, I'm here.
Yeah.
My name's Clinton. I don't really have anything to add at all. I don't know if Leonie does. She's here as well. I see there's a few people signed up in the scenario sign up, but yeah, we'll all be there on the day.
Yep.
That's about it.
No, that's good. Yep.
Is it worth mentioning that William's actually looking to get some sort of testing coverage feedback for the IGs?
Yeah, I think that's right. So I think they are at a point now, point of maturity where, yeah, Liam is looking for that feedback. So for people to test this out and sort of exercise it and see whether it's fit for purpose. So yeah, definitely testing feedback on this will be one of Liam's focus to get that.
And the other one is the Smart Health Checks Inferno test kit is actually quite unique because it actually has write back capability as well. So it actually tests your write endpoint. So if anyone sort of wants something that is beyond AE core, which is read only, that in test kit might be able to exercise some writes back to your API if you've got that capability.
Yeah, and all the links to all this stuff is all available on that info page. So there's links out to all these resources and the like from that info page. So I just haven't put them in the slide deck. So if you want to go and investigate those before the event, I'd definitely recommend that. Okay, moving on, connected test scenarios. So this is sort of where we're doing a bit different. So this is where this is a bit different to if you've been to one of the other previous Spark testing events or a Connectathon where we have been a bit more siloed. So we're trying to build some scenarios that give you opportunities to sort of test those interactions across multiple IGs. Now, you might not be capable of that, which is fine. Each of these scenarios will have steps and they're all optional. So it's not necessarily about going through the scenario from start to finish and being able to complete all of it. It's really finding opportunities where your system and your interest is at contributing to a scenario. And so we've tried to create them that they're quite generic, they're quite flexible, that they're really just providing some sort of guidance on how we might want to try and connect systems in different ways. So you're by no means bound to these. It's really about trying to find opportunities where you might want to test and stretch those boundaries of what we might have tested before. So we've got 5 scenarios here. The first one is an e-request, e-referral with a provider lookup. Scenario 2 is smart app launch with resource write back. Scenario 3 is patient summary exchange and reconciliation. Scenario 4 is medication dispense with reconciliation. And scenario 5 is appointment lifecycle with encounter exchange. So what we will do is just have a look at each of these. I won't go through them in too much detail. They are all available from underneath the info page, but we'll go through and give you a bit of a flavour of what they are. So again, with each of these, with each scenario, again, we're going to have a primary contact for that. So if you're looking to try and work out how to work through this, you can go to that primary contact and at least have a familiar face to go to. So the e-request, e-referral with provider lookup scenario, Michael Osborne will be the primary contact for that. And the objective for this is connected testing of e-requesting workflows. And we've added in, including provider discovery, supporting information exchange and status tracking. And it covers the Health Connect provider directory, AU e-requesting, AU patient summary, and AU core IG. So this is probably the most interconnected scenario that we have. And you'll see in the steps here that we've kind of tried to integrate each of those IGs. And the first step here is about requesting system search as a provider directory to find a service provider. And then the requesting system creates an e-request or an e-referral. So we're not trying to pigeonhole if you're doing referrals, that's fine. But if you're going to use the e-request IG, well, that's great too. And then kind of even pushing the boundary on bit of that, maybe you want to provide some additional information, and this is something that might not be captured in the IG at the moment, but maybe attaching a patient summary for additional context as well in that request or referral. And then the fulfilling system would display the request and any supporting info. The fulfillment system might update the fulfillment status of the request. The requesting system monitors and displays fulfillment status, and there's an opportunity here for a patient app to display the request, referral details, and fulfillment status. So, like I said, we're looking for people to sign up to these, but you may not be able to do all of these, and you're probably unlikely you'll be able to do all of these. But if you're just, interested in doing provider directory searches, you can just sign up to step 1. I'm not even going to create a request. I want to search the provider directory. So you can still fit in this scenario, even if you're not necessarily doing all the steps. You just patient app, you just might want to go find a request on a server and do that. So we're not necessarily looking for this to be end-to-end, full system integration. We start at 1, go through a number of systems, and we come out at number 6. It's really just saying, well, there's some different places here. If I want to do step 3, let's go find someone who's got a server and got a request in it, and I can display it. So this is just to provide that sort of guidance on where you might want to look to try and connect someone to do some things that your system might be able to do. Are there any questions on that one before I move on? Happy to take questions on these scenarios as we go, rather than come back to them. But I'll move on, but feel free to jump in, ask questions. The next one will be the smart app launch and resource write back scenario, and Liam will be the primary contact for this one. So this one is connected testing a smart app launch, pre-population from FHIR data and write back of captured information. And it can cover smart health checks, GP, CCMP, AU patient summary, and AU core. So the first step in this one kept it quite generic. So a clinical system launches a smart app, and that, you know what, that may be a questionnaire, smart form, the like. It may not, maybe another type of smart app that you're bringing along to the event. It could be any type of smart app, but it may also be one of the ones that we're trying to test with the IGs. And you might launch it with additional context, like a specific questionnaire, using the questionnaire FHIR context. Then a smart app retrieves FHIR resources from the clinical system. Again, if this was a questionnaire or a form, it might be pre-populating that form. But again, it might be doing something different. There's plenty of flexibility there. User enters information into the smart app, and this might be completing the form, and then the smart app writes back FHIR resources on completion to the clinical system. And this might be the questionnaire response, it might be extracted resources. Again, plenty of flexibility there. And then the last step is the clinical system reflects the changes in the patient record. And one way you might want to do that is actually generating a patient summary that shows the new information is captured by the app. So that's all there. I see a bit going on the chat. Is there anything?
Nothing important.
No, nothing important. It's being addressed. Going back and forth, that's good. So yeah, so if you've got a smart app, if you're doing questionnaires, you're doing forms, this would be the one for you to try and sort of pick out some of these steps that you might be interested in doing. Next one is patient summary, exchange and reconciliation. Danielle will be the primary contact for this one. And we're looking here for connected testing of patient summary exchange and reconciliation of summary context into the patient record. And this one covers patient summary and AU core. So looking at a consuming system, obtaining a patient summary from a producing system. So this might be a request, it might be directed exchange, it might be patient mediated through smart health links or some other method. So again, depending on how you want to try and interact with another system to get this patient summary, you've got lots of options there. And the consumer system displays the patient summary. So this is kind of our traditional patient summary testing. You go get one and go and display it. Then looking to extend this a bit further, that the consuming system might try and identify items for import into the patient record. So this might be things you want to take from the patient summary and put into your system, maybe medications, allergies, conditions, something like that. And then your consumer system importing those items into the patient record. So that's one of the challenges we've talked about how we might do this. So getting people to explore how we might import items that are part of a patient summary into your system can be explored there. And then the last one is consumer system reflects the changes in the patient record. And maybe this is generating another patient summary in your system to show that it now has the additional information that you imported from that system. So again, if you're looking at this, maybe you're just looking at steps 1 and 2. If you're trying to do just traditional retrieve and display a patient summary, if you want to push the boundaries, or you're looking at to explore some of these other concepts, you can look at some of the other ones as well. Scenario 4 is medication dispense with reconciliation, and Steph will be the primary contact for this one. The objective of this one is connected testing of medication dispense data, exchange and reconciliation into the patient medications list. So this is looking at AU core and patient summary. Now, we'll look at utilizing the new medication dispense profile in AU core. So a dispensing system serves the medication dispense data, and a consuming system retrieves the dispense data. So pretty simple, just try and get the data. But then extending that further, well, consuming system might try and reconcile the dispense data against the patient's medication list. Maybe try and update the number of dispensers or import the medication information. So another type of reconciliation type use case there. And then the consuming system reflecting the changes in the patient record. And again, you might want to do this by generating a patient summary or show it on the screen or do something like that. It shows an updated medication list. And there's an opportunity here for a patient system as well to retrieve and display the dispense information, for example, through a patient. Moving on to the last one, an appointment life cycle with encounter exchange. Landon's looking at this one. And this one's, the objective of this one is connected testing across an appointment to encounter workflow from provider and slot delivery to exchange of encounter information. Looking at AE core and provider directory. So this is obviously looking to do some things that we don't necessarily have coverage for yet, like bookings and the like. So, but a booking system searches a provider directory to find a provider or a service. The booking system finds an available slot and creates an appointment in a provider system. Provider system links the appointment to an encounter and records encounter information during the visit. And then a patient system retrieves and displays encounter information to the patient after the visit. So they're the 5 base scenarios. Was going to, if we want, we can jump into a Menti now too, which I will, which is about where your interest lies in these, and be interested to see. We've put a sort of 5 up there. If there's not enough interest, we don't need to have coverage on all of them, but we tried to cover most of the IGs in some way, and hoping that people were interested in participating in some of those. So I'd just be curious from this call where people's interest is. And there is a Menti after this for the other. So if you put other, the next one we're going to go to will be get you to sort of suggest what those others might be. A bit of a spread.
Was it intended to only have one choice?
No, it was not. That
You should be able to live edit then.
People are submitted probably.
Yeah.
Maybe.
Yeah, sorry, that was a mistake on my part. Let me see what I can do. Oh. If I can do that over here.
So if you just ESC out of or escape out of, I think, the presenter view, I think you can hit edit view.
Multiple selection.
And then, yeah,
okay,
I think that works. And then present again. But we might have to.
That works now.
Yep. Cool.
Okay. If you've already submitted,
probably. Yeah.
Yeah, you probably can't. But
Let me just check. Yeah. No, I can resubmit.
Okay, if you can resubmit, that's might skew the numbers a bit, but it's it's subjective. It's all right. Interesting. No one's interested in the medication dispense. Well, no one on the call is.
It's a good point. Who do we have on the call? Like, who does medication dispense? Like, do we have pharmacy on the call?
Don't see anyone.
I don't know that we do.
This was one, it was raised as something as part of registration. And I'll be curious actually if we've had anyone sign up to it. Yeah. Let's jump to, yeah. So, no, we haven't had anyone sign up to it yet on the page either. So maybe that's one that doesn't get exercised on the day.
So is there anyone from OXA on the line? Because I know OXA also does like a bunch of prescription stuff, but I don't know if OXA does dispense info.
Ryan's on the call.
Oh, cool.
Is it the right Ryan?
It is. I was just chatting. We are in pharmacy, but not strictly dispense. So I'll have a look. I don't know if it's as relevant for us.
That's interesting. There's definitely plenty of interest in Smart App launch. Any request and patient summary. So that's good. That's where we normally have plenty of interest as well. And there's a good bit of interest in appointment lifecycle too. So that's good. I will jump to the next one then, because there's a couple of others here. So what are the others? Is there something that you didn't see there, but you'd think, I really want to test it. I want to find others that I can test with on the day. I'll put the QR code back up in case you've lost it. No others? I'm typing. Was that you, Michael, last one? I saw you put your phone down as soon as that popped up.
Yeah, you caught me out.
Who else?
Well, again, there's plenty of opportunity on the day. Like these are guides, these scenarios. We want to try and showcase some interoperability. But if there are others that we can coordinate, let us know. We're happy to look at other scenarios if there's interest. Provider directory bulk export. I think we can fit that within our existing scenarios potentially. Like the scenarios are just a guide, right? We've deliberately made them quite flexible. It's really to sort of focus some attention and go, thinking around some common testing scenarios that we might want to focus on. But there's plenty of room to move within those scenarios. So if you want to do some variations on it, you're absolutely free to do so. Really just we want to showcase that interoperability. Okay.
Ricardo, you were thinking of doing the bulk export, or was that you that suggested it for provider directory? Is Ricardo? No.
I think Ricardo
Ricardo's
is
not on the line.
absent. Yes, that's right, Keith. Yeah, provide directory bulk export. We are keen to get it tested.
Yeah.
I think I kind of had the same question. We could probably follow that up actually at the Spark testing event. I've never, I mean, all the bulk export stuff that I've really heard about is around pop health reporting. So I'm quite intrigued by like a provider directory doing a bulk export and what the use case is for that. Like where is that going and what is that reporting into? But we can do that on the day.
We did have it in the IG slide for here. So taking a bulk export of the national system populated local directory. So I think it's like the location of the directory.
I can flesh that out a bit
so
more.
It's like an instantiation approach.
The
Okay.
use case is for other jurisdictions that have poor network capabilities to be able to have a local directory that's based on their subset of the national directory.
Cool. Interesting.
I'm thinking it wouldn't be just jurisdictions, so.
No, it could be anyone. So the functionality has been developed, and once you go through the conformance process, you'll have access to be able to do a bulk export.
Okay. I'll just jump back to up to. Oh, sorry. Make everyone dizzy. Okay, so we didn't have much there. Oh, the AU Core and AU CDI. Did anyone want to talk to that?
Yeah, hi, it's Chris from the Australian CDC. Yeah, we've got some test scripts that we're hoping to run through more from a population health perspective than individual patients. So that's something we're keen to investigate further on, have a look how it goes.
So for testing scenarios, what would you be looking to sort of, who would you be looking to connect with and sort of test there?
That's going to be part of the question. So I think
So I understand you're going to bring some fire resources, is that right? So you're looking to bring some fire resources and you're looking to share with others?
Yes, Ali, would you agree?
Test.
Yeah, so I guess we're jumping in the spirit of this being a very early stage for the Australian CDC to engage with how we can use fire best for our interoperability requirements. So we do have some fire resources we're hoping to test, and really grateful for guidance on the best way for us to do that. The scenarios we've chosen, I guess the use cases we've chosen from our perspective are a notifiable disease notification and GP sentinel surveillance. So we just thought that interaction between that state and territory submitting a notifiable disease notification and also that sentinel data coming from general practice might be interesting for us to test in terms of how we can apply AU Core and AU CDI in this context. So I guess, yeah, coming in early, but we just thought it'd be good to engage in this way to really kick off our thinking about it. And especially based on the discussion just now at this meeting, I think we'll learn a lot too about other things happening around the place that we might be able to engage with. But it is very early for us, so we're quite new to this conversation. So happy for any thoughts, advice.
Yeah. Okay. Yeah, I think there'll be opportunity there to do just some testing around validation against AU Core and the like as well, to see whether these are conformant to AU Core. There might be people who have servers that you might be able to connect to send them to and see whether they are able to accept them and the like. So yeah, we can certainly do some testing outside of those scenarios as well. Around
Great,
that.
thanks.
Okay, just gonna jump back. Okay, so it is important for you to sign up to those scenarios. So we do have that Confluence page, and signing up before the event so we can make sure that we know who's interested, that we have enough interest in the scenarios, that we have people that are capable of connecting to each other and the like. So the link to that, I will jump to the right screen. So that's here on this connected test scenarios page. I'll put the direct link to that in the chat. So here, this is where any of these scenarios that you're interested in participating, go to the scenario. In this scenario, you can edit the page, go to the scenario, sign up, add your system details in here and which steps you're interested in participating in there, and any notes or comments you might have to go with that as well, so that we can then sort of coordinate that activity in that scenario. So it's important that you do that, and if you can do that prior to the event, sooner rather than later, would be great, so that we know where that interest lies. As far as testing tools, some testing tools that will be available that you can use during the event. We will have this development terminology server that will be available there. So it will include the AU Core patient summary, e-requesting profiles, and terminology. It'll support validate code, and expand. So for all your terminology requirements, that will be there and available. On the day, we also have the HL7 Australia Fire Test Data GitHub repo. So this is a fantastic source of test data So we've got in there patients, practitioners, practitioner roles, organisations, and more. It's all synthetic data, but it's all been created with the endorsement of allocations from Services Australia for identifiers and telephone numbers and addresses and the like. So it's excellent test data that you can reuse in your own systems for testing. We're using it on the Spark servers. And so to get you started, if you're looking for test data, that GitHub repository is an excellent source to start with. And it's on our reference servers. If you are bringing your own test data and have test data in your own system, make sure it is genuine test data for this event. Don't use any personal or protected health information. It's really important that we make sure we're using safe data for this. So if you don't have any, but a great place to look is in that GitHub repo as well. We also have Inferno test kits. So this enables you to test fire-based solutions, and we have test kits available for AU Core and for Patient Summary, and is missing off the list here, but Liam does have one as well for the smart health checks and the like. So they're available, they're great. It's a great tool to try and test your solution and see whether it's working with those IGs. So if you have a look at that, again, have a look at these before the event. You can reach out if you need any help trying to navigate them and work them out. But those automated test kits are very useful as well for testing your systems. Providing feedback and test results. So getting your feedback provides a wealth of information back to the IGs about whether they're fit for purpose and the like. So providing feedback, you can share your experiences, your feedback, and help improve the IGs. So I think that's the great opportunity about this community, is that rather than just getting a standard, looking at it going, I don't like this, it doesn't work, it doesn't do what I need it, you've got the opportunity to provide that feedback and influence the ongoing development and enhancement of these IGs. So that's what we get out of these events, is that you can actually help shape the future of these IGs. So providing that feedback is great for the IGs, and it's great for you because then you can help influence where they go. Each of the IGs potentially has a different process for how you would raise that feedback. But if you talk to the lead or anyone in a Spark shirt and ask about the best way to provide that feedback, for example, in AU Core and Patient Summary, that would be raising jurors. For that, I think the agency has a different process for providing feedback on the provider directory, and Liam does as well. But we absolutely want that feedback. So if you've got anything you want to raise changes, you want to make some suggestions, raising that feedback is a great thing that we can get out of this event. And we'll help you do it there and then at the event. So rather than have to walk away, do it. If you want a hand creating that feedback, we can do it there and then at the event. Test results as well. Like, we'd love your test results. If you've been testing, you've been generating some things, consuming some things, this helps prove the maturity of the IGs, and we can use that to look at the test coverage. We don't care about passes and fails and the like. It's just showing that you've exercised these implementation guides and tested certain parts of it. Because what we're finding out here is whether the implementation guide is actually fit for purpose, as well as your testing to see whether your system behaves the way you thought it would. We're very much interested in that test results from parts of the implementation guide that have been tested. So if you've got test outputs, and then this can be raw JSON files, it can be screenshots, it can be whatever you've got available, but we use this to assess the maturity of the implementation guides. So if you've got those, Spark team members may come along, tap you on the shoulder and ask you if you've got some of this. We won't be sharing your individual test results like that. We don't care whether pass or fails, it's irrelevant. It's just about what sort of parts of the IG you have tested. And then we report that back to our work groups to say, you know, we had 3 systems test this profile and these elements on that profile, which shows that profile is maturing in our implementation guide. And yeah, we we won't publish your individual results. Test results eventually get destroyed under our Spark privacy policy, but they're useful. If you are providing test results as well, we can also recognize your contribution to Spark, and you can have your logo on the website saying you've been contributing to testing as part of Spark. So it's a good opportunity for you to sort of show that you've been actively participating in the community. So we've only got a couple of minutes left. So I'm just going to, so this is the checklist for the day prior to the event. So have a look at that testing information page, go through the info on there, have a look at some of the testing resources that are available. Complete the past participant system details. So that's important. So that's your system details. That's how to connect to your system. If you don't have it available yet, put placeholder in there, and once your system's ready and available, you can put the final details in there. But participants will need that on the day so they can connect to your system. Sign up to those connected test scenarios so we can see where different systems are looking to participate in them. Have a look through the IG guides and the details there. And most importantly is prep your system for testing. We've only got one day. By the time we have breaks and people start chatting and that, there's not a lot of time in there on the day. So the more prep you can do prior to the event, the better, because then you can hit the ground running. So if you want to start building some stuff towards some of those scenarios, and reach out to other participants and saying, well, can we do some testing beforehand? That is all really useful so we get the most out of the day. I think on that, I'll probably just have one last Menti, which is whether we want to have another session. So this was, oh, sorry. This last, oh, sorry. Okay. So this one's just to see whether, do we want to have another one of these sessions where we can help you prep for the event? So if we want to have one maybe next week or something prior to the event, that we can help you prep for the event, answer some more technical, detailed questions and the like, we can do that. So this is sort of gauging interest on where that might be. Look at that, even Stevens.
I mean, I think there's already enough participants.
Yeah,
some people don't need it. Some people, depending on the scenario, it really makes sense to try to like line up. So I think there's already enough people that it's worth putting in a call and, you know, just let people turn up.
Yep. So that one, this would be unstructured. So we won't have a presentation. It won't be me here talking to you the whole time. Come to that with your questions, with what you want to bring, what you want to achieve, what, and then we can help you sort of prep for that. I'll probably look to put it in the calendar, probably same time next week on the Wednesday in this time slot, so that we can do that. It'll be optional. But if you want to come, you want some assistance, you want to chat to the Spark team, you're welcome.
But I think it would also be also like thinking through some scenarios. So people are going to be signing up for different scenarios and connecting the different systems who have said, I'll do this part, I'll do that other part, and just talking through what that might look like on the day.
Yeah, that's right. I think, and it's basically getting us so we hit the ground running. You're prepped and we're prepped to sort of make the most out of the day. So yeah, I'll set that up. I'll put that out for the same time next week. Heath.
I might have missed it, but was there a Zulip channel set up for this? And do we want to perhaps? Yeah, it looks like there is.
Yeah.
Do we want to offer that as a sort of a coordination channel as well, if people are looking for someone to play with or set up something, prepare against, that kind of thing? Is that?
Yep, absolutely. And anything event related you can use in that chat. So yeah, if you want to coordinate some things before the event, you want to reach out and say, hey, is anyone coming to the event that can do this? And we can maybe connect before the event. find a friend, then absolutely use the chat for that. So that's probably the best place to communicate openly there. There's no dumb questions. You can post whatever you like in that chat. So
and that might also help sort of with next week as well. So next week's call.
Yeah.
So if you ask a question there, I know you don't get any responses, and we can perhaps use that as a platform to address some questions or find a friend, that kind of thing.
Yep, absolutely. We've got some FAQs there as well. We've got the information page. If you have any other things that don't fit in any of those categories, you can email us at sparked@CSIRO as well to get your questions answered there. So we're at time. I'm happy to take any other questions though, if anyone's got any they'd like to ask now before we wrap up. But if not, I'll either see you at the one of these we have in a week's time, or I'll see you at the event, or I'll be talking to you in chat.fi.org.
Thanks, Michael.
Thanks, everyone.
Awesome. Thank you.
Thanks, Michael. Thanks all.
Thank you.
Thank you.
Thank you.
Cheers. Bye.